Hello and welcome to another ICD-11 video. I'm Dr. Islam Ibrahim from the National Center for Health Information, and in this video, I want to introduce you to ICD-11's answer to country-specific modifications. We had a problem with ICD-10. ICD-10 was used only for classifying the clinician's documented diagnosis into categories for statistical reporting. So, although very useful for mortality, its original use case, it was deficient in reflecting the level of detail required for morbidity, such as the details we need for DRG systems or case mix systems. But because of its great potential, countries adopted ICD-10, but some had to modify it for their morbidity use cases, adding the lacking extra details. But because these details were added by different countries, the modifications themselves were not standardized, jeopardizing the comparability of morbidity data. And of course, adopting any of these modifications is not free. For example, the code Y37 does not exist in ICD-10. It does in the Australian modification, where specifically Y37.5 represents allergy to food additives. The US modification, ICD-10-CM, or clinical modification, also has the same code, but it represents military operations involving nuclear weapons. So if ICD-10 was a cinema, then on the Australian modification side, Y37.5 would be the Barbie of codes, but on the US side, it would be the Oppenheimer of codes. Let's take another example. In WHO ICD-10, J95.8 is the code for other post-procedural respiratory disorders. We have only one code for that. To have more detail, the US modification created 16 codes under J95.8, of which J95.84 is the code for transfusion-related acute lung injury. The Australian modification also has more detail than the WHO version. It has 6 codes under J95.8, of which J95.84 is the code for post-procedural pneumothorax, a completely different condition. So, doesn't the US modification have a code for post-procedural pneumothorax? It does, but it's J95.811. And doesn't the Australian modification have a code J95.81? It does, but it's the code for post-procedural tracheal stenosis. Of course, it's important to note that these country-specific modified codes are not used for international reporting. But wouldn't it be helpful for all of us to report our details in a standardized manner, and therefore in today's digital age to be able to share our data at the international level? The solution lies in ICD-11. ICD-11 includes two types of codes. STEM codes. These are entities that provide on their own meaningful information on clinical conditions. So STEM codes can be used alone for coding. Extension codes, on the other hand, are entities that add detail to STEM codes, such as anatomy, histopathology, and so on. So extension codes cannot be used alone for coding. Instead, they must be added to a STEM code. It's like ordering a main dish. You can, if you want, eat the main dish alone, but you may choose to add one or more side dishes, which the restaurant would probably not serve alone. The offered side dishes, of course, always match the main dish you ordered. Let's take an example. Eyelid abscess is a meaningful description of a clinical condition that can be a stand-alone diagnosis. But the treating physician might like to add more detail to this diagnosis to improve the quality of their clinical documentation, such as laterality, specific anatomy, or the infectious agents. ICD-11 has a STEM code for eyelid abscess because, on its own, it represents a meaningful clinical condition. Alone, the term left and the term lower eyelid do not represent meaningful clinical conditions. So each of these two terms is given an extension code by ICD-11. So how do we add details to our diagnoses in ICD-11? We use Postcoordination. It's just like ordering your meal on a food delivery app. After choosing your main dish, you get to choose the sides. Let's see how it works in ICD-11. So we type the diagnosis in the search box. Then we find the entity we want. ICD-11 allows us to add details to this diagnosis by clicking the plus icon or details. We can now add that the abscess was on the left lower eyelid and specify the infectious agent. We end up with a cluster. A cluster is a group of linked ICD-11 codes used to describe a documented diagnostic statement in detail. Post-coordination is the process by which ICD-11 creates clusters. So why do we have post-coordination in ICD-11? Think of a set of building blocks. You can build many different shapes with a limited number of blocks because you can use the same block in different shapes. In the same manner, post-coordination enables ICD-11 to address a large number of clinical concepts with a limited range of categories. For example, ICD-11 has one code for abscess of eyelid, but it doesn't have one for abscess of left lower eyelid. It doesn't even have one for abscess of lower eyelid. In previous versions of ICD, like ICD-10, if you wanted to have a unique code for abscess of lower eyelid, we would have had to create a new pre-coordinated code that includes all the relevant information in one code. But post-coordination allows us to code that detail without adding more codes in the classification, simply by combining the code for lower eyelid with the code for abscess of eyelid. Having an extension code for lower eyelid enables us to add detail not only to abscess of eyelid, but also to any other clinical condition that can affect the lower eyelid, giving details to a large number of other diagnoses through the use of the same extension code. It's a much smarter way to add details to our diagnoses, instead of having to create a huge classification of so many pre-coordinated codes to be able to have the level of detail we need. So in ICD-10, if you wanted to play with a duck, you have to get a duck. You want to play with a house, you have to get a house. You want to play with a car, you have to get a car. But in ICD-11, all you need is one set of building blocks. You can then use that to make a house, or a car, or a duck. You can make a small duck or a big duck. It's up to you. It's based on your use case. For example, in mortality, external causes matter more than the harm, whereas in morbidity, we care more about the harm or injury. Post-coordination allows us to choose the level of detail we add while keeping the extras standardized. Thanks to post-coordination, ICD-11 can now accommodate variable levels of granularity that are required by different national health systems in a standardized manner, potentially eliminating the need to develop multiple country-specific modifications of ICD, improving the comparability of clinical data across the world. The level of detail we use is based on our use case. Some countries may choose to use less detail, some may need more. But in all cases, even those who add details will add it in a standardized manner. Thank you for watching and see you in our next video.